Welcome to the BACCH and BACAPH mini-module on Understanding Health and Disease as part of the NHS Long-Term Plan Improving Services series. The purpose of this presentation is to explore the development of health or disease in ways that can inform the planning, delivery and evaluation of interventions to improve outcomes and equity. The design and delivery of integrated healthcare within a whole system requires an understanding of the creation or causation of health and disease and the interaction between the determinants that contribute to quality and duration of life. The NHS Long-Term Plan recognises the contribution of clinical care only represents about 20% of overall health and well-being. The remainder is determined by behaviours and lifestyles, the distribution of resources within the economy, and the physical and natural environments in which we live. Creating alignment and synergy between the various factors that contribute to health and disease is an essential element of integrated care planning. This mini-module briefly provides an overview of epidemiological concepts that contribute to pathogenesis or salutogenesis. The majority of the module will be revision for those with a health background, but could be considered an introduction to epidemiology for those from a non-health background. The module introduces the Haddon matrix and considers its application for children and family using injury or obesity as examples. There are many different ways of illustrating how factors or health determinants interact to create either health or disease. The Dahlgren-Whitehead model is probably the most often recognised and quoted in public health or health promotion. In the centre of the diagram is the individual, surrounded by lifestyle factors in orange, then social and community networks in yellow, again surrounded by socio-economic, cultural and environmental factors in green and lilac. It was preceded by the Bronfenbrenner diagram, who talks about micro, meso and macro ecological systems, with many subsequent adaptations to his diagram. While it is good for conceptualizing and writing public health essays, it is less good for planning or delivering strategies at either a local or national level. More recently, circular diagrams have become popular. In the centre are the domains of health, nutrition, security and safety, responsive caregiving and learning opportunities. Once again, there are expanding influences relating to family, communities, wider society, including supportive services in the surrounding rings. Some diagrams then have the Sustainable Development Goals surrounding the outer ring. The problem with all of these slightly over-inclusive descriptions is that they are difficult to use in practice. Traditional teaching has considered three elements that contribute to the formation of a disease or a condition. The usual starting point is the agent, which is the cause of the problem, for example, a bacteria in the infectious disease world or an energy source in the non-communicable disease world of injury. The effect of the agent is then modified by the host, in this case a human, who may be resistant by being immunized or vulnerable by being malnourished, or resistant by wearing protective gear in the injury example. I now want to introduce you to a new word. Most of you will be familiar with pathogenesis, but the flip side of that coin is salutogenesis. As we have said, when you consider any condition, there is an interaction between an agent, a host, both which function within a wider environment. In most medical studies, the agent is usually negative, either an infectious agent in the communicable disease world or a hazard in the non-communicable disease world. But actually agents can potentially be assets and have a positive impact on health. Salutogenesis considers the positive elements, so in this scenario that would be a resilient host, the asset elements of the agent and a positive health promoting environment. The health of the child cannot really be completely separated from the health of the family. But in this diagram I've isolated the child from the family as there are some child-specific factors that need to be considered. I've used the terms vulnerable and resilient when referring to the child and strengths and weaknesses when referring to the family. I've also included the concept of vectors, carrying the infectious disease agent, in the case of malaria, or kinetic energy in an injury example. The word environment should be considered widely as it includes the physical, social and economic environments. In most conditions, there are multiple factors at work, which we will explore later in the injury and obesity examples. I would now like to pause for a moment to consider what we mean by the word risk. In common parlance, risk is generally seen as a negative term implying a risk of harm from a hazard. But as we've seen in salutogenesis, the host, the agent or the environment may all also be positive as well as negative. Throughout this mini-module, the word risk is used in a neutral way and merely represents a combination of the likelihood of exposure and the probability of an effect. For example, if we consider burns from open fires, the likelihood of exposure represents the number of households with open fires, and the probability of effect represents the numbers using or not using fire guards. Exposure to sunlight is an interesting example. Sunlight exposure can be both positive and negative. As we all know, lack of sun exposure leads to both rickets and contributes to seasonal affective disorder. Moderate exposure to sunlight creates healthy bones and also elevates the mood. However, excess exposure can produce sunburn in the short term and risk of melanoma in the long term. Individual vulnerability will depend on skin pigmentation, duration and intensity of the exposure, and the use of sunscreens. The social environment may also have an effect. The culture around suntans and use of sunscreens, the physical environment also plays a part, meaning access to shade or latitude. There are many examples where exposure can be both positive and negative. For example, food and either malnutrition and obesity, screen time and either learning or addiction, and many others. All I have done now is to split the elements of the Venn diagram because I hope this will help understanding of some of the tables that will follow. Here is a Haddon matrix. Its commonest use relates to road traffic injuries. On the vertical axis is the timeline from pre-injury through injury to post-injury. On the horizontal axis is the host, the agent and the environmental factors. This 3x3 matrix then creates a framework both for understanding causation of the disease in the pathogenic model or condition prevention in the salutogenic model. This list is reasonably self-explanatory. Each line relates to one cell in the previous slide. This matrix allows you to identify and understand the interaction of the many factors which contribute to injury and may need to be tackled to prevent future injuries. The same matrix could be reframed to highlight the positive factors that contribute to, say, school readiness. So we can use the same matrix to identify interventions that are effective in controlling the problem, again illustrated here using road traffic injuries. It's interesting to note that human beings far prefer post-injury drama rather than pre-injury prevention, meaning helicopters and first aid at the bottom of the cliff rather than a fence at the top. Generally, pre-injury interventions are labelled as primary prevention, interventions around the time of the injury called secondary prevention, and post-injury interventions called tertiary prevention. In this slide I've tried to represent the two opposing forces of pathogenesis on the right and salutogenesis on the left, creating vicious and virtuous cycles with their combined effect on outcomes for the individual in the centre. The individual may start life predisposed to certain conditions for either genetic or social reasons. Exposure to health factors relating to lifestyle or wider determinants then make them more susceptible to either health or disease. The outcome will then be further influenced by exposure factors resulting in consequences, for example comorbidities, all contributing to the overall health outcomes. This will be covered in more detail in the Life Course Pathway mini-module. Decreasing obesity and improving mental health are probably the two most challenging conditions most affecting the health of the nation, especially post-COVID. Patterns of obesity are often established in early life, and effective prevention requires a life course approach, not just focusing on eating less and moving more, but recognizing that obesity is a normal response to an abnormal food environment. Sadly, the initial obesity plan focused more on changing the behavior through individual interventions rather than restricting access on a population basis to the agent largely responsible, meaning cheap calories. This is the first of two slides comparing Brave and Bold with the obesity plan. You can see many of the evidence-based recommendations of Public Health England and the Health Select Committee were not endorsed in the obesity plan, except for the sugar tax and the reformulation programme to reduce sugar content. You can see here that the obesity plan focused on individual actions and contained many elements that were not included in Brave and Bold. This is a simplified Haddon matrix with elements of food-orientated interventions to reduce obesity. This time the vertical axes are life stages rather than pre and post a particular event. It is an illustration of the approach rather than a comprehensive table that includes all potential interventions. For example, some interventions, such as reduced advertising, are applicable to all ages. Each cell contains both positive and negative factors leading to promotion and protection. In this slide I've used the matrix approach but using a Venn diagram to illustrate the interaction between lifestyles, determinants and services, with the intention of thinking about responsibility and influence. Who has control or influence or responsibility over the determinants under consideration? The epidemiology literature is very inconsistent in the semantics it uses to represent various types of determinant of health or disease. In this module I will use the term lifestyles to represent those factors that individuals have some control over, largely their behaviour. The word determinants reflects those factors that individuals have less control over, for example air quality, poverty or housing. In this diagram, services would include health, education and social care and the many others that contribute to health and well-being. In this slide I have attempted to describe the interaction between services, determinants and lifestyles. I have also introduced the concepts of upstream and downstream. Generally, upstream interventions are delivered on a population basis, for example macroeconomic policies to reduce poverty, whereas downstream interventions are more orientated towards individuals, for example money management and debt counselling. Public health services offer both screening and immunisation on a population basis, and then also health education on specific topics to individuals. I now want to introduce the concept behind the life course pathway approach, which will be the subject of another mini-module. On the right we have a diagram illustrating the interaction between services, lifestyles and determinants and their cumulative effect on health, remembering that the effect of specific determinants will be very different at different ages. For example, nutritional advice for the infant is very different from that of the young person. Likewise, exposure to different hazards or assets is very age dependent, as with increasing age there is more independence and individual autonomy. This slide introduces the concept of equity. On the vertical axis is health and on the horizontal axis are stages of life. The circles represent the health determinants within the host, the agent and the environment, which interact in ways to produce good health or poor health, which is represented by the upper and lower blue lines. Exposure to positive determinants creates better and longer lives, whereas exposure to negative elements shortens and impedes quality of life. The difference between the two is the health equity gap. Now let's take this matrix approach to the next level. In the left-hand column we have the life course pathway starting in the antenatal period and running through to early adulthood. In the next two columns we have positive and negative lifestyle issues, and in the next two columns the positive and negative health determinants that are largely outside the immediate control of families. Finally, we have the contribution made by health services. So far we've considered food-related factors, but obviously exercise also plays a role, and in this example, exercise-related issues such as screen time and sleep are included. It's important that there is alignment and synergy between the various elements, so for example, encouraging individuals to have a more active lifestyle may require safe routes to school to enable walking rather than car use, and affordable active leisure activities that are accessible to the age group under consideration. The role of the health service is often to manage the problems produced by poor health determinants, but it's important for the health service to be part of the local process of creating an obesity plan, both to reinforce the preventative messages to individual patients, as well as monitoring the impact of community-based interventions. The role of the health service will be considered again in the mini-module examining population health management. This mini-module has described the interaction between a host, an agent, and the environment. Each element can be either positive or negative, and there are complex interactions with both short-term and long-term effects, particularly for long-term non-communicable disease such as obesity or mental health. The life course pathway approach is merely a way of describing the accumulating impact of various health factors on health and disease. When planning interventions, these health factors can be grouped as relating to lifestyles generally under the control of individuals, or wider determinants operating at a population level. It is essential that there is alignment and synergy between the various interventions for maximum effect. You have now reached the end of this mini-module, and I would recommend reading the paper entitled Understanding Health and Disease to reinforce these messages.